Hi everybody, my name is Lindy. I'm the Project Coordinator for Digital Health at South East Melbourne PHN. We're presenting to you today and our learning objectives will be understanding the legislative framework and participation obligations for access and use of My Health Record, describe the importance of My Health Record security and access policy that's relevant to this legislation, understand how to develop and implement a My Health Record security and access policy for your organisation, and identify cybersecurity risks. Also, implementing password management procedures. The My Health Record system is supported by a legislative framework that sets the controls around who can access the system and the information within. The agency has very helpful checklists available to assist practices with navigation of this, and it will be sent out with the slides today. So what are your My Health obligations? Before you use the My Health Record system, you must have a security and access policy. This should be reviewed annually, and we'll send out an agency template with the slide pack from today. When you first set up My Health Record, a responsible officer and an organisational maintenance officer are nominated. Consider who these are and keep them updated with staff movements. Most common softwares are My Health Record compliant. If your software isn't compliant to My Health Record, consider using the provider portal. Training of your staff, provide refresher training and keep a training register. Keep your user accounts maintained and up to date. Comply with all notifiable data breaches and respond to any requests made by the systems operator of the My Health Record. The Office of the Australian Information Commissioner has developed a template for the use for the My Health Record. If you can download the template from the Australian Health Agency website on the included link, which of course will be in the slides. The My Health Record security and access policy must be communicated, enforced and available to all employees at the organisation. It must detail the user management, including who is authorising person, who is accessing the system, how user accounts are managed and processed if the user's security is compromised. It must ensure users are trained in the system or aware of their legal obligations of using the system and the consequences of breaching the obligations. The policy outlines the process for identifying a person who requests access to a healthcare recipient's record. This will generally occur through the clinical software or the provider portal using the Healthcare Provider Identifier, the HIPI. It must include the details of physical and IT security measures in the clinic to mitigate risk and prevent unauthorised access. We'll be covering off on some of those measures in the cybersecurity presentation today. It must include a strategy for managing security incidents such as ransomware, data breach, and use of the audit logs. If the organisation offers assisted registration, this needs to be covered in the policy. The policy must be reviewed annually, or when new changes are identified, it must include version numbers, dates, updated, and when the next review is due. There is an e-learning module available for the security and access policy. The agency or the Office of the Australian Information Commissioner may request a current or previous versions of your policy at any time. This slide is an example of a training register that can be used for the security and access policy, showing current staff status and deactivated users. This is also available in the slides from today. We have some links here for the support in developing the policy. So the Office of the Australian Information Commissioner has some guidance. Digital Health website has a participation obligation and policy checklist. There are e-learning modules available developing a My Health Record security and access policy for your organisation, My Health Record Rules 2016, and My Health Record training opportunities. So when the slides come out, have a look at some of those links if you need any help with anything. Now that's it from me. It's over to Barb.
Thank you, Lindy. There is an emergency access function in the My Health Record which providers can use if they believe that there is a serious threat to life or the health and safety of the patient or the public. However, do be mindful that the patient will be aware of who has accessed their record via this emergency access, and the Digital Health Agency may also inquire with the provider to provide a reason that they have accessed the record. The agency will send a monthly email report to the organisation to list when the emergency access was undertaken, and it is advised that the organisations review this report to ensure that the approved circumstances meet the criteria as outlined in section 64. It's important that if your organisation, it's important that the organisation report any data breaches to the agency. And please note, the agency will not advise of a data breach. It's the organisation's responsibility to review the access via emergency function, determine if in fact a data breach has occurred. This email will be sent to the responsible officer. So therefore it becomes important the organisation keep the email contact list up to date in HPOS so that the right person gets the report in all circumstances. The agency can also send a report regarding a specific event, and there needs to be a response as this may result in penalties applying under the Privacy Act 1988. Just do not test the emergency function access on patients. The agency has a training simulator where you can test this functionality. There's also a webinar available on the emergency access as an on-demand webinar and resources on the agency's website. Next slide, please, Lindy. Patients can set up their own controls in their My Health Record, including a limited document access code, which the patient will provide to the provider to access documents that the patients have restricted access to, and also a record access code, which means the patient needs to provide a code to the provider for the provider to be able to access the My Health Record. The code only needs to be entered once, and it actually applies across the whole of the healthcare organisation. Some types of documents cannot have restricted access, and these include shared health summaries, personal health summaries, advanced care plans, and custodian details. There is a link to the additional resources on the right-hand side of this slide where you can get further information on this. Next slide, please, Lindy. And there are, just a reminder, there are penalties for misuse of the information of My Health Record that include significant fines as well. Next slide, please, Lindy. And here we have some examples of inappropriate use. So do not be tempted to use the patient's My Health Record for training purposes within your organisation. Again, you can use the Digital Health Agency's training simulators for this purpose. Next slide, please, Lindy. And the Australian Digital Health Agency provides a range of training e-learning modules that can be accessed via their website, along with webinar recordings and future webinars with links to consumer information, such as patient brochures and guides. And refresher ongoing training for all staff accessing the My Health Record is recommended, and this is where you can access some of those resources to provide that training to your staff. Next slide, please, Lindy. So for further information, you can contact the Digital Health Agency on these links. There will be a slide at the end that will also have all the PHNs. This is a collaborative webinar of all the Victorian PHNs, and links to all the your PHN support will be on the last slide at the end of the webinar. Next slide, please, Lindy. So just a little tip, a little shortcut for you. Where do you start? You start with there is a checklist available, as Lindy spoke of before. So start with the Digital Health Agency My Health Record checklist. You can download the policy template, train your staff, and make sure you have all your My Health Record ducks lined up in a row, and only then connect to the My Health Record service. And also complete the e-learning module on My Health Records privacy access. I'm now going to hand over to Brendan Kennedy, who's a technical manager and senior system engineer with Joe's Health IT, whom we're very lucky to have presenting today on cybersecurity. Thank you, Brendan.
Thank you very much. Let me just get my screen organised. Is that all come up correctly?
Yes.
Yep.
Okay. Thank you very much. So today is just a bit of a 101 in digital security and cybersecurity about how clinics can look after their patient data and look after their systems. So we'll talk about what phishing emails are, how you can identify them, and what actions you should take if you receive them. Passwords, creating, managing, rotating and sharing passwords. Data safety, what you can do to help protect your patient information. Security incidents, if you receive them, and what to do about them. Just some general safe browsing habits to help you, avoid these sorts of incidents in the first place. Talk very briefly about approved software, and then finally for clinics, it'll be about preventing a disaster, making sure that your backups are in place, and how you can manage them. And this is not just a scenario where this is a talk to talk. These are actual events that are happening at the moment. So these are a number of sites that have been breached, that have had records taken in just the last couple of months. So it's not something that it might happen to you. It's more of a case now of it can happen to anyone at any point in time. And then one of the more, I suppose, pointed ones that for the health department or health industry, the St. Vincent's were breached last year as well, and some of the information that they were able to get access to. So for cybersecurity and the way that we need to think about it is that we want to try and get people to adjust their mindset. So everyone knows what they need to do when it comes to personal security. You at your home and at your business, you lock your doors, you lock windows, you have alarms. If you're going overseas, you make sure you've got the appropriate currency, you've got insurance, you've got credentials to prove who you are. So you need to think about it is in adapting that personal security to your digital security as well. So think about putting locks on your system, two-factor authentication, making sure that you've got effectively a passport to access your own medical data. When you're doing patient communications, you really need to, at the end of the day, protect your practice because it's your business that you're protecting. So what is a phishing email? And as the picture suggests, it is pretty much, throwing a line out there with a little hook on the end, trying to entice you into clicking into something that you're not supposed to. So typically it's a social engineering attack. It's designed to steal your credentials, your credit card details, or just really, pretend to be someone else. So usually they are masquerading as a trusted entity. It might be your power provider, it might be one of your staff members, it might be a doctor, it might be anyone within your business that you're used to dealing with on a regular basis. And the idea of them is to send you an email that's got a link in it, and it might very well have, malicious software attached. So how do you go about identifying one? So in this particular example, if you look at the very top, we have an email address that says it's from account support, but just very briefly, you can see it's from a Gmail account. So just using 30 seconds to look at the email and go, oh, hang on a sec, that doesn't quite seem right. And in the body of the email, it'll create a sense of urgency for you to action it as quickly as possible so that you can get access to your system again, or whatever financial record you have. Again, in this particular instance, the domain at the very top looks very similar to Microsoft, but it's not Microsoft. So there's a spelling mistake. It's been just manipulated ever so slightly. And again, it's asking you to sign in. So it wants your credentials, sense of urgency to restore your service. Third example here would be, a doctor or a patient or, a third-party vendor has sent you an email saying that, we haven't been paid or our accounts have been changed. But in this particular example, they're asking for a payment urgently, but they can't be contacted. They will call you when they're free. So again, any sense of urgency, but any email requesting you to update bank details should always be verbally verified. So pick up the phone, give them a call, make sure that they're actually requesting, those bank details to be changed. Again, other instances, just people requesting updated bank details. You should always look. The sender details in this instance are incorrect. It's from some random address overseas. Urgent request for payment, and in other instances where they'll change the phone number or they'll just change the email address ever so slightly so it looks correct. But in this instance, the email is from a .com when it should be from a .com.au, and the phone numbers have been manipulated, so the numbers have been flipped around. So there's always something there that, something that might just grab your attention. So things to take into account. Emails being received at odd hours of the day. If you're getting an email at 3 a.m. in the morning from a doctor asking for them to update their bank details, go, why are they sending it at 3 a.m. in the morning? Is it remittance advice, or is it someone requesting a payment that's out of sync? So if you're always expecting these things to come in at the end of the month, then it's only the 10th or the 12th. It might be just out of sync. Is it someone sending you remittance advice for something that you haven't necessarily paid for, or a service that you're not expecting to be used? Half the time they are just links to websites that steal your credentials. So just keep that in mind. And if there's any chance, or in any of the emails where they're requesting you, a username and password to access a system or to get restored, just always just take that as a red flag. And generic salutations, half the time they come from overseas. The spelling and the grammar is always usually a giveaway. Things like ChatGTP are going to start making things like that harder, because they'll be able to just have it create the email for them and then send it out. So this type of action is going to get harder and harder to detect. So you really need to go through the process and training your staff. Just training yourself, if something doesn't seem right, just take 30 seconds and think before you click on that link. So what actions should you take if you do receive one? Avoid clicking on the links or downloading the attachments. Report it to your IT support provider. Tell other staff in the clinic, might have been sent to 3 or 4 people, advise them that you think it's a dodgy email, and then of course delete it. But again, what if you're that unlucky user that you've clicked on it? Well, first of all, don't panic. Just notify your IT support provider as soon as you can. Change your passwords. If in doubt, switch the computer on that you're off. If you're on a computer at reception, just pull the power out, leave it off until someone can come and have a look at it. Being a computer down versus being your entire clinic down, it's next to nothing. So, again, just don't panic and just do, follow those steps. So passwords, again, every GP's worst nightmare, every staff member's, every nurse's worst nightmare, having to log in 5 times a day. But we strongly recommend strong passwords. So they are of the utmost importance to make sure that people only access the data they're meant to access. So what is a strong password or a complex password? it's there really so that, make sure your passwords are there to make it harder for people to get in. So how do you create one? So it should be a minimum of 8 characters. We recommend 12. Should include both upper and lowercase characters with case sensitivity, at least one number, at least one special character. And avoid using easily guessed elements such as your children's name, your dog's name, your birthdays, your wife's name. There's so much social engineering out there at the moment, whether you post on Facebook or if you post on Instagram or TikTok or whatever it is you might use, you might talk about your social circle, and it's very easy for that information to be gathered. So how would you go about creating one? So choose a password that's easy to remember and make it unique, like a phrase. Maybe you enjoy coffee, cup of joe. Create it so that it's something that's unique to you, but it's not something that can be socially engineered. And on the screenshot on the side gives you a little bit of an example of how you can replace some of the names and spelling in something that you might use on a regular basis. So managing passwords. Should you have sticky notes on your monitors with usernames and passwords? Absolutely not. It's far too easy for someone now with the camera on their phone to quickly take a snap of it and you wouldn't even know. Should you be sharing passwords with other staff in the business? Well, no, not anymore. Especially if you've got controlled medical record access. If you need to know which nurse it was that accessed the record or which reception staff member it was that accessed the record, you need to have unique accounts for each of those staff members so that you can manage the access with them. And whether a receptionist deleted a password or whether a doctor sent something accidentally to the wrong person. So you need to manage that process. Should you use the same password for multiple logons? No, you shouldn't. Half the time your credentials are stolen, they're actually from third-party websites. So let's say you do shopping online through Coles or Woolworths or whoever it is, or your favorite shoe shop. Maybe their website gets compromised and your username and password is there. Another website gets compromised and the same username and password are there. And then all of a sudden, all of your details, someone's been able to pick up that you're using the same username and password in multiple applications. So if you need to create a dummy email, have a work email and then have a throwaway Gmail account or Outlook account. So if you're doing online shopping or whatnot, you're not using the email address that's linked to your medical center or your business. Multi-factor authentication. Should you be using it? Absolutely, especially when it comes to email, whether it be through Microsoft Authenticator, Google Authenticator, for remote access through things like Duo two-factor security. So you should be setting up your business so that there are multiple levels of authentication to prove that the person connecting is actually the person connecting. How often should you change your password? Well, you should change your password at least every 6 months at a bare minimum, and with a preference to every 3 months. Now, if you have a 20-character password, changing that every 3 months might be a little bit problematic, but you still should go through the process to change as much as possible. If you suspect you've clicked on a phishing email, or if you've had a data breach of any description, or if you're just unsure that someone's accessed your account, immediately change your password and move on to the next digital or character, whatever it is that you're using. So when it comes to sensitive information, what can you do to help protect patient information? Lock your computer when you walk away from the desk. Most clinics will have a screensaver that kicks in after a few minutes, but it only takes a few minutes for someone to enter your room and do something. It's a very quick shortcut on your keyboard, the Windows key and L, if you don't know it, locks your computer straight away as soon as you walk away. Don't leave documents unattended on printers. Number of occasions that we've gone in on weekends and replaced computers or printers, and there's been a stack of paper on there with a patient transfer or confidential information that relates to patients. Try not to leave them. Keep your desk clean. If there are patient transfer information or just anything in relation to patient medical history, try to keep it in the right spot. If you don't need it anymore, have secure disposal. Always check the email address that you're sending to. So double check it to make sure that you're sending to the right person. A lot of the breaches that occur in relation to sending, data security breaches are actually user fault based on just sending it to the wrong person. If you do receive something, don't mistakenly hit reply all. If you just need to send a medical certificate back to the patient, you don't necessarily need to send it to everyone that they may have sent that email to. Anything with patient information should be password protected at all times. So whether that be through your medical application, there will be an option to tick a box that says send this with a password, or if you're using Adobe PDF Creator or Qt PDF Writer, there's an option to create passwords. Always protect your information. Even if it is a medical certificate, part of the accreditation requirements is that you send information encrypted or password protected. It might be difficult for the person on the other end to deal with, but you are doing the right thing for your practice. And possibly a little bit less, for medical centers, but who's listening? Who's standing around you? Who's at reception? Who's behind you? Just don't discuss patient information in a public space. And for those that have secured areas, just see who follows you in. You might have a key tag that gets you into a staff-only area. Or into a section where there's doctor's information or doctor's bags. So just be aware of your surroundings. So what should you report? So if email's been sent to the wrong person, report that to your manager as soon as possible. An unintended release of a publication, maybe you've put a social media post that accidentally has patient information, should be notified as quickly as possible. Let's say you've had patient information on a USB drive or a CD-ROM drive, anything that, or your backups as an example. Maybe you've lost the backup. Granted, they might be encrypted, but report that anyway. So 43% of all human-related breaches are based on the fact that they've been sent to the wrong recipient. 21% of those are then related to also human error-related breaches when uploading or releasing information incorrectly, and the last is 8%. And this is from the Office of Information Commissioner. These are from 2022. I haven't updated these recently, but malicious attacks account for some of it, but a good large portion of it relates to the person in charge of the mouse, the person sending the email. So don't be that person, I guess, is what I'm trying to say. Just have a moment, take 30 seconds to think about it, and just double check that you're sending it to the right place. So there's just a little bit more information on those stats. So what should you report to your IT support? Well, if you're getting one of these, you need to give your IT support a call. This is an old one, but half the time all your data is encrypted. So give them a call. If you fall suspect to a phishing email, don't be afraid to speak up and say, "Oh, I think I clicked on this and I shouldn't have." Try and stick your hand up. I made a mistake. Get it fixed as quickly as possible. Don't be that person that hides in the corner and says, "Well, no, that wasn't me." That makes it worse and harder to fix. If you're trying to log into an account and it says that you're locked out for whatever reason, by all means, contact your IT support provider, because someone else is trying to log in as you somewhere. So what else do you need? How do you have safe browsing habits? Have antivirus software that's updated daily. Your Windows updates enabled. Avoid pop-ups. Most of these are just viruses. Inappropriate websites. Just don't, it's all tracked. Just don't. Attachments from unknown senders. Verify links in emails. Some of you will already know, but if you hover over the URL in an email, it'll show you the full web address. So have a look, make sure it's going to the right spot. As I said before, use a disposable email address for non-business purposes. You don't need to have all your eggs in one basket when it comes to email. And back up your data. So if it's your data, be responsible for it, back it up. Approved software. So why is approved software important? Well, it's software that's been tested. It's not going to have hidden flaws that's going to jeopardize the operation of your business. Usually they've been tested at least vigorously by a number of different people or organizations, and they're beyond doubt of what they're used for. So how does an application become approved? Contact your IT provider, whoever that might be, and get them to verify that the piece of software is legitimate, that it's going to be compatible, it's going to work on your system. Don't just grab any old piece of software off a website and go, oh, this is going to integrate with my medical application and allow me to do fancy things with patient data. You don't know where that data is going. You don't know what the application is doing. It takes 5 minutes, send an email, have them do some due diligence and come back to you. So approved software, most of the time, these are just some examples. These are everything that you're going to use on a regular basis anyway. So, just be mindful. Worst case scenario, if you're looking to use a product that's going to integrate with your medical application, call the vendor, call best practice, call ZBed, call medical director, ask them if this software is legitimate, ask them if they're partnered, confirm with them that they're going to do the right thing with that data. And then finally, understand your backups. So make sure that you understand how and where your data is stored. So someone in your business needs to be responsible. Someone in your clinic needs to own the process. Have someone, whether that be your practice manager or the business owner or a staff member, have someone who gets the notifications, who knows who has access to your backups, knows where, what's being backed up. Understanding whether or not it's just things like your medical records, or if it's your email or your organizational data. Understand what actually is being backed up. Understand where they're going. Are they going to USB drives that get taken off site, stored in glove boxes and purses and bags and potentially get lost? Are they going to network attached storage somewhere in your building? Do you have cloud backups? Understand when they're running. Do they run every 15 minutes? Do they run every hour? Do they run once a day? Understand that, so that if you do have a problem, or if data's gone missing or something's been deleted, you know that, okay, my backups run every hour. I'm going to lose an hour's worth of data if we have to restore for whatever particular reason. And understand how they're run. Check with your IT provider. Find out, are they full backups? What we call them incremental backups. Are they just a data copy? And the reason I say that is all of this depends on how, if you do suffer a data breach or a ransomware, or you get locked out of your data, all of this is going to then outline how long it's going to take you to get that data back and how long it's going to take your clinic to be fully operational. And then that is a financial impact against your clinic. You might be closed for 2 days, 3 days, depending on the quality of your backups. But lastly, have it tested. Make sure it works. Have your IT provider do what we would call a DR test, or a disaster recovery test. Prove that it works, so that you've got some sort of guarantee that if your backups, if you do have a problem, or you might have a weather event. We had quite big, large storms a few weeks ago that a number of clinics got damaged from. Understand that it's not just hackers that you might need to get your data back from. It might be your building burns down, or you might get flooded. There's any number of reasons why having good, solid backups are a great resource. If you do want, for any particular reason, we do have an IT security checklist. If you want, send an email to the email address on the screen, and it just goes through a number of different, things in terms of, things that we recommend or that you should have within your business, whether it be from email protection to account management, remote access policies, your backup assessment, firewalls, Wi-Fi access within the building, and things like that. So I will hand back now to PHM.
I might jump in. We've just had a couple of questions. Hi, everyone. I'm Tara Brazier from the Eastern Melbourne PH, and we just had a question in the chat in regards to the passwords. And the question is using password apps like 1Password safe, and should we be using it?
Using apps like that are safe in some respects, but if you do a very quick search, you will find that applications like 1Pass or LastPass, they've all been hacked in the past as well. They all then rely on one trusted password, or master key as such. That master key needs to be in a safe place, needs to be written down or on a piece of paper and put in a filing cabinet somewhere. That should not be accessible anywhere online at all, because if you've got your login credentials for your password manager and your master password, then you may as well have given them the keys to get access to everything.
Thanks, Brendan. There's just another question has come in, and we have another comment they'd like to know a little bit more about password managers, which they haven't started using. Are there any that you can maybe recommend?
Look, there are a number of password managers out there. Again, LastPass, 1Password, I think Kaspersky have password manager as well. I don't actually use a password manager myself. I try and use the grey matter in my head as much as possible. Doesn't always work, but yeah, it's up to you. There are certainly plenty of options out there. If you want something specific, or if you want some other recommendations, just shoot us an email to that email address that was on screen, and I'll reply with some options for you.
Thank you. And we have another question in here that is there an extra cost involved when checking that data backup is working, or is this part of routine costs?
It depends on your IT provider. That is a question you'll have to ask them, I'm afraid. From my perspective, the business and company that we work for, we do this on a monthly basis for all of our clients, and it's included in the fees that we charge them.
Thank you, Brendan. There's no other questions in the chat, but if there is, I will ask at the end. Thanks all. I'm passing back to
Nicole.
Barb.
Yeah, Nicole.
Thanks, Nicole.
Amazing. Thank you so much for that. Give me 1 second. I'm just going to share my screen.
Always nice to get a bit of time back.
Absolutely. Thank you all for being a part of this session. If there are no other questions, it has been an absolute pleasure to have you all here this afternoon. I hope you've taken away some valuable insights, and I'd also like to extend a special thank you to our exceptional presenters for their fabulous work. At the end of the session, a link to the workshop survey will appear on your screen. Please do take a moment to fill out that survey so that we can further improve these education sessions. Your responses are greatly appreciated. There will be a follow-up email that everyone will receive, which will include a copy of the presentations you've seen today, in addition to other relevant resources and a link to the recording. You will also receive a certificate within the next 4 weeks of this session from your PHN group. I think that's correct, Barb. Yep, awesome. Thank you all for your time and attention today. That is all from us, and enjoy the rest of your day. Thank you so much.